Well, it has been just 2 years since Angelina Jolie had a double mastectomy to reduce her chances of getting cancer. And now the star announcing she's had her ovaries removed after early signs of the disease.
These are drastic steps, of course, but they've inspired other women to seek testing, and it may be at odds with new screening guidelines. Did she go about this the right way, and are those guidelines enough to protect you? Joining us now is Fox News Medical A-Team, Dr. David Samadi. Doctor, great to see you this morning.
Good morning, guys.
So are the guidelines enough?
Look, the guidelines are all moving targets, and they are changing year by year. So we used to get, for example, like mammograms for women at the age of 40. They moved it up to 50. And now we have about 10% of women are getting less mammograms as a result of this because they say it doesn't really help. Same thing happened with prostate cancer. You remember, PSA, we used to get them, the blood test for screening, we used to get them for at the age of 40. Now it went up to 50. And now we're seeing men coming in with more aggressive prostate cancers. So what she has done, which is brilliant, she hasn't really followed a lot of these guidelines out there. She took the health in her own hand. She went on to learn about her risk. So this is what we did about 6 months ago. I was so upset about these guidelines that I said we're going to have Samadi Challenge. We want people to learn about the risk. So she found out what her family history were, what is that BRCA genetic test. In order to improve her quality of life for her children, she went ahead and she got screening. And then when she was found out to have these issues, she went and she got the mastectomy. Now, for a 39-year-old to go ahead and get ovaries out, that's a big deal. But she understands the risk of having these kind of cancers. A lot of message to people out there: post your messages and your pictures, and if you are a cancer survivor, I want to hear about you. And so on SamadiMD.com today, we have all the guidelines, what the government recommends, what we think you should be doing. And so government also talks about death all the time, right? That's the end goal. But they don't talk about metastases and how these cancers can spread and change your whole quality. It's a very difficult time, and we hope that these organizations wake up and really treat everyone individually.
Well, we appreciate your passion. Of course, what's the website where people can go?
SamadiMD.com. That's a blog, and we're going to post a lot of information. There's about 20 pages going up as we speak for people to learn about the risk, what to do, etc. Very important topic.
Wonderful. Dr. David Samadi, always great to see you.
And we commend her for what she's done for her and hopefully for the rest of the country.
I'm bringing a lot of
awareness
to it. Thanks, Doctor.
Thank you.